The things I'm concerned about at this point, Lori, are do we have the policies in place to continue that level of readiness? So there's some bipartisan support, but also bipartisan debate in Congress right now about re-upping our supply of tests and treatments and boosters, and making sure they stay up to date, making sure they're ready for a surge or another wave of infections that could come this summer, could come again in the winter, depending on how things unfold with immunity and the variants. And are we taking the steps needed in our routine approaches to life to use these steps effectively to manage the pandemic? And that means probably less dependence on big emergency public health responses. There's not a lot of consensus at the state level or the federal level for new spending on public health or new authorities. So that means that the support needs to come from two other places. One is our healthcare system getting more oriented towards helping people, especially those at risk, get into test and treat programs to prevent hospitalizations, helping to keep the boosters available and keeping informed, trusted information available to individuals so that we can get those booster rates up. They're not as high as many other countries are right now. And making sure that if there is this continuing surge in cases, it does not translate into surges in hospitalizations and deaths and the things that made the previous COVID waves really disruptive. And then there's a role for businesses too, recognizing that hybrid work is probably a reality going forward, that some of employees may want to and may even need to be encouraged to wear masks in certain situations, to make sure that your employees are aware of not only the boosters, but these other supports that are available so that they can, if they do experience COVID, they can avoid serious complications and avoid spread to people who may be at higher risk. These can all make COVID manageable for the long term, but we're just in the process, Lori, of getting used to what the future with COVID may be like, and there's still some important steps that we need to take to be prepared for it.